We are live, so let's go now. Welcome, Jonathan, Michelle, Michael. Thank you so much. Hopefully that talk was interesting, inspiring. A lot of folks interested in the course, Michael, and so I think they'll be interested in trying out some of the other experiences that Michelle and John you've created as well. Would love to, when we started the initiative, we were interested in having faculty input to help us shape what this looks like, how we could support the university, how we can support students and faculty. Michael, you were the first one, and then we added Michelle, and then we added John. So could you talk a little bit, Michael? You can maybe introduce yourself and just talk about what this role has been like for you.
Okay, it's cool. And we are live, right? Just to clarify.
We are live.
Okay, that's good. That's
well,
good.
Once you came on stage, you're live.
We just wanted to do some behind the scenes chat.
Yep.
But okay, here we are. So yes, I saw the keynote. I think it's very relevant. I like the questions, and it's great to see so many students actually also ask about where we can learn more. And then a few students who have already taken some of the courses. So I'm Michael Niebling. I'm an assistant professor in what is called here the School of Information, and I'm also affiliated with computer science and engineering. My research area is in human computer interaction, right? So quite a mouthful, HCI. And so I'm really interested in getting users, and it's all kinds of people work with these technologies. And so that includes designers and developers. So those who are creating these experiences, I do teach quite a few courses on getting people up to speed with these technologies, but I'm also really intrigued in the applications. So accessibility is one of my favorite areas where I think we can these technologies can have a huge impact. Do you want to go around, Jeremy?
Yeah. Michelle, okay. Do you want to introduce yourself next?
Yeah. So, well, thank you for having me here. So I'm Michelle Eversold. I'm a clinical professor in the School of Nursing here, and I also have a faculty position over in the School of Information, which makes me Michael's colleague. And I'm a faculty innovator in residence, which makes me Michael and Jonathan's colleague. So super excited to really continue working in this area. So for me, XR is really a way to look at different technology platforms that we can use for healthcare training. Primarily I focus on a lot developing things to really help our healthcare workers, nurses, and other professionals to really improve in patient safety, to really support patient outcomes. So that's sort of my focus, and it really touches sort of a lot of areas. And I kind of jump back and forth between, AR and AR/MR and VR with my work. But most recently, most of it's been in the VR area.
Great, thanks. John?
All right. Hi, everyone. Good afternoon. So my name is Jonathan Rule. I'm an architect and also an assistant professor of practice, which is the equivalent of a clinical professor in architecture at the Taubman College School of Architecture and Urban Planning here at the University of Michigan. So some of the work that I've been doing is mainly focused on design of architecture, material, different material innovations with digital fabrication, and also looking at construction and the use of XR in the AEC industry. A lot of the stuff actually that Jeremy Schreibler was mentioning in the previous talk. So I think he kind of gave a pretty good overview of what I do. And so a lot of the work that I've been looking at, especially with Jeremy and this group, is how do you begin to teach some of these concepts that are quite opaque to somebody that's not used to looking at architectural drawings and construction documents, and how do you begin to leverage virtual environments or augmented environments as a way to engage users that might not be as adept to understanding that type of information. And so that's the work that I've been doing. Actually, there's a parallel session I think going on right now that's going to explain augmented tectonics a little bit more in depth. So you're welcome to stay here, but if you want to learn more about that, go over there.
And it will be recorded, so you can check that out later as well. Really cool work. Well, thank you. It's been great having all three of you help us shape the initiative and provide your input and advocate for these technologies across campus. Maybe I'll start with you, Michelle. What has the XR initiative meant to you in your role and for the university, do you think?
So I think for me, one of the things that I love about working here is there are just so many people doing so many cool things across campus. And being a part of this sort of XR innovator group gives me an opportunity to really dedicate a piece of my time sort of focused on not just the work I do at the School of Nursing, but how can we sort of support this in a much broader perspective. So getting involved in working with a lot of students and, working with other faculty, looking at collaborating on projects. Not that I couldn't do that on my own, but this just sort of lends a little bit of sort of formality to it. It sort of creates that, part of my kind of service to the university in a way that really helps me think about ways of bringing XR beyond just my own area of work, which is in healthcare. And like Jonathan and I put a grant in together. And so kind of combining, what I know about nursing work environments, particularly right now, everybody's so tired after the pandemic, that we really have a crisis going on. And then Jonathan, with all of his, great work in architecture, we could collaborate around things. I've collaborated with Michael. And then being able to work directly with the Center for Academic Innovation, the XR initiative there, also gives me an opportunity to get help with my equipment, because, it was one thing to try to figure out how to manage a bunch of, patient simulators, but now I have a bunch of headsets on top of that. But then also to be able to share supplies, share learning, share other things with everyone. So I guess sort of the takeaway that I would say is it's just a nice way of being part of this group that gives you a place where you can bounce off ideas and just generate stuff that we can, share out to the university as a whole. So
that's great. Yeah, and it's your perspective has been great, right? I mean, you were teaching with Second Life, years ago, right? So a lot of those concepts translate quite well, and some of the challenges you had are the same challenges we're having in 3D.
Yep.
So that's really been helpful for us. Michael, from your perspective, you created the XR for Everybody MOOC. You teach the required courses for the XR graduate certificate. Like this is your space. So how has the initiative impacted your work or your role here?
Yeah, so I think one of the things as a professor, you do quite a few things. You do your research in your little research world, and we all have our networks. Then we teach our students, we teach our classes, we have PhD students. So my research everybody's introduction was much better rehearsed than mine. But what I do is human-computer interaction and user experience design and research. So that's when you only work in this space, then this gives you the lens on these technologies, and then you think XR is all about that. But I think through the faculty innovator in residence kind of position, first of all, it gave us, I'm still a relatively young professor in the academic system. It gave us potential to help leadership think about XR, not only in our own little research worlds and in our own schools and departments. The University of Michigan is really big, so it took me 5 years to get to know, let's say, 10% of the people that really work on XR. So in the first few years, we really established this network of people and building bridges into all these different departments and schools. And I just thought when you joined into this position, so there was a lot of AR/VR work going on, and there was some initial coordination efforts between several colleges, but it really needed somebody like you who really understands this role as a coach and as a connector. And so I think I've benefited a lot also by working with somebody who has this expertise like you. I've enjoyed connecting across the university. And then I think in year 2, what we're doing at the moment is also trying to take our experience and share it with other universities. So to me, it's very important that, we always pride ourselves in our XR initiative, and actually a lot of our other institutions think this is really great that we have it. And a lot of universities have announced similar things, but often it is often just a facade. It's not actually clear what's happening, and there's actually not as much to it as it is as it always sounds like. But I think we have a network, we have infrastructure support, we have funding support, we have ongoing research, we have the teaching stuff going on. So overall, I think like there's a lot of successes, but then also we can learn from the other universities. So I'm most excited about taking it into other universities and libraries, and because it doesn't have to be expensive. It doesn't have to be the $6 million announcement to get things started. We started small, and others can do it too.
Yeah, no, that's great. I love, we connect with many other institutions and collaborate with them. And you know, there was already a lot happening here at Michigan before the XR initiative started, right? It wasn't like, hey, there's the initiative and now everything's happening. I think it was just kind of bringing some structure and support and community around that. You know, Jonathan, you were teaching, you'd created some VR applications before the initiative started. And like, how has having this resource or kind of having access to students in these projects impacted your work and what Taubman College is doing?
Yeah, no, it's actually been a fantastic resource. Jeremy mentioned I was trying to do my own thing prior to this through different grants at the university. And I'm trained as an architect, so I'm really adept at building worlds in virtual space and then producing them in the real world. But I have no idea how to program or anything like that. So actually, I was stalking Michael for like probably a couple of months prior to the pandemic, trying to get him to help me with my projects. And he totally refused, but that's okay. I understand, Michael.
Yeah.
And then, but then Jeremy showed up on the scene and saved me by providing through the Center for Academic Innovation opportunities and resources and the XR initiative to help faculty that have a certain skill set and a certain knowledge base in something, but then to begin to realize it and manifest it in extended realities. So for me, it's been a fantastic resource, and then also just being able to encourage other faculty at the college, at Taubman College, to tap into it as a way to kind of build steam for it around campus, I think has been really important and really fruitful.
Yeah, that's great. Yeah, I see. I mean, architecture just makes sense to me as these technologies can enhance how students create and do critiques and collaborate and do walkthroughs and understand their space at a new level. As someone that struggles with trying to look at 2D images and understanding perspective, it's been amazing for me. Well, how about in terms of, we've done a lot, we've, through year two, what would you like to see the university do with XR in the future? Where would you like to see this go? I'll open it up for anyone. Michelle?
Yeah, so, I was thinking a little bit about that. And I was at a conference last week, just talking to people about using XR in nursing and that. And I think we often think about, so how do you, what do you do with it? Like, where does it make sense to use it and where doesn't it make sense? And I think right now, we're certainly in the early experimental stages of things. Let's try some different things out and see what works and see what doesn't. But in terms of sort of how we formalize this or take it the next step at Michigan, I think it is sort of continuing to build on what we've already started, where, we have a lot of faculty across the campuses that have started to work with programs and developing things that are presenting here today. And then I think it's like, take some of those successes, that things that are working, and then let's figure out how to sort of, I'm going to use a term from business, kind of hardwire that into our curriculum. So, where does it make sense? So for instance, I'll just talk about some of my work that I'm doing is like with the Under the Skin project. So now it's developed, we have a few more tweaks to do. We certainly can push it out to the public. However, what also needs to happen is a conversation, perhaps at our school, perhaps over at the Rogel Cancer Center, to say, okay, here is this educational tool that you can use, and then let's help people sort of move it into their curricular activities or into their training or onboarding of new employees, things like that. So I think it's being able to start to not only continue to get people to sort of create some of this work, but then now let's figure out how we want to let's take it beyond the research and the user design and move it into a place where we can start to continue to use it. And I think some people are doing a great job at that, and some people have been doing that for a while. I mean, certainly simulation is completely and thoroughly embedded in healthcare education. And we do a lot of great stuff with our mannequins and our standardized patients. We just need to now sort of figure out how to sort of fit that, XR things into that, and where does it replace something we're doing? Where does it add to something we're doing? So for me, I kind of think of that as the next logical step.
Great. Jonathan?
Yeah, I think, like Jeremy had mentioned in the previous presentation, like it's still not yet mainstream. And I think, like, how do you make this more and more mainstream? And so is that developing certain logics or certain ways of doing things, or integrating it, as Michelle said, into the curriculum, hardwiring it? I think thinking about maybe those rule sets and what that might begin to look like at a broader cross-campus level. I think right now we're currently working, even though we do have this great connection through the XR innovation project that you've set up, Jeremy, how do we make sure that all these things that are sort of happening individually are sort of somehow linked together collectively? I know, like, the university, we use platforms like Google Classroom or Canvas or things like that. And so those have all been technologies that have been developed over a long period of time. And so now this is starting to move in the direction of XR. And so not saying that we're going to be replacing those tools, but in the same or a similar vein, like, how do we begin to make those things somewhat normalized within the way that we teach and work together every day? Yeah, I think we've kind of done a lot of these sort of like one-offs and very particular to our fields of interest and research. And so how do we, I think, just make it more universal, possibly, is sort of the way that I might envision it going, which I think is also the same thing that even as far as like an industry, XR industry goes, like, how do you make things more universal, that you can pick up a phone and you kind of know how that is. It's very intuitive, whereas all of these technologies are still somewhat opaque to the end user. And how do you kind of integrate it more seamlessly into all aspects of life and learning as we kind of know it today?
Great. Yes. Yeah, it is a challenge with all the different devices and platforms, and how do we make things integrate and work better? Michael, what do you think? Where do you want to see the university go?
So a lot of what my colleagues said, I think we just, in general, we want to see like higher adoption, I guess, both among faculty and among students. We want to increase the access to these technologies. It's even at a place like Michigan that is like at the forefront, as we claim, but there is maybe 5 professors on campus who walk into the classroom with a headset. I mean, it's not that it's first of all, it requires a lot of preparation and really setting things up and planning things carefully. And then it's also not super useful to just have like one person in a headset and then everybody else needs to imagine what it's like. It's just very difficult still to get to the access to these technologies. And then whenever you use these technologies, I mean, we talked in the keynote a little bit about accessibility, but I mean, I'm more like siding with the instructors who believe that if I cannot provide the content in an accessible format, then I will not provide the content at all, just to be more inclusive. And so what I do like is, and that is a little bit hidden, but I think it's important work that's happening, and where we can also connect some of it better, is our IT services and our teams focused on instructional support. So people, apart from the XR initiative that is housed in academic innovation, But people who need to provide infrastructure so that students can submit assignments, we can check for cheating and things like that. They are aware that AR and VR is coming and that it's increasingly used in classes. And I think it's good that they're gearing up, and it's actually self-driven. There's a few good people in the leadership who recognize the potential of these technologies. But like overall, you know what? If I could make one wish, I would just make a very strategic set of calls. I wouldn't create a center of XR or something like that. But what I would do is I would think about how some of the schools were maybe the most promises, or where a lot of activity has happened in the past, to really create positions that are focused on XR, because ultimately, I think it will only work through the school. So this approach that you're taking with the innovators, of taking an innovator from architecture, School of Nursing, and tightly connected to medicine, and then me with computer science and engineering and information, is actually really good, because you reach out into all these different disciplines that you want to work together, and you have very powerful applications that are very convincing. So the vendors like Microsoft or Oculus, they don't give money to Michael because Michael doesn't do the applications. Michael just wants to improve these technologies. But like the real deal is at the intersection. When you have a few innovators that can innovate technologies to really create really powerful applications. So the projects, didn't remember that I ignored Jonathan like he said, but sorry about that. But with Michelle, we've done a few cool projects in the past where we brought mixed reality technologies into a crisis simulation course in our school, and then also triage training with Michelle. And it was just very exciting to work with domain experts. And then on top of that, obviously, Michelle is an expert both in her domain and in XR. So it's very exciting. So what I would wish for myself is in the future, in 5 years in the future, I would like to teach principles and things beyond some of the things I teach right now. Right now, I teach a lot of the basic stuff, and it's very repetitive. Every year, a new audience comes in who hasn't actually done a lot of AR, VR stuff in the past. But we could work on so much more exciting challenges if we had better adoption and more expertise. And I hope we'll grow over the next few years in that regard, and then I can offer more advanced courses, for example.
Yeah, that's great. I mean, I think that we think about it as like these networks of XR across the institution, right? Like it can't be top down. It can't be coming through a central unit. But I mean, there's areas.
Some universities have taken that approach, right? We've been analyzing a little bit. Yeah.
I like our approach. The size of Michigan, right? With all the the 50,000 faculty and staff and 50,000 students, that it just wouldn't work too well here. But so how do we kind of best of both worlds, where we have some central support, but then we have expertise kind of at the school or college level? I think that's
importantly. It doesn't have to start in computer science. It doesn't even need computer science most of the time. I think we have most of our movements actually outside of computer science. I mean, related, but not actually inside CS. And most people would probably imagine that all this stuff belongs in computer science. But it's actually, I mean, it's a big portion, but it's not exclusive. And so I like it that we originated outside and are connecting back to CS.
Yeah, I mean, it's really transdisciplinary. It's with the tools today, you don't have to code that much. I mean, you need to know how to code or how to build systems, but you don't need to.
You need patience.
Yes, testing, lots of testing. I want to take. We have about 5 minutes left. I want to take some questions from the chat here. Do you have workshops for faculty development on XR teaching? We haven't run any workshops yet. We do consult, so we hold one-on-one consulting sessions for any faculty that are interested to kind of help them understand what are they trying to do. Is this the right technology? But I think that's an area that we'd like, if there are common interests, hold some of the shops. We have done it with some of the 360 video authoring that you'll hear about in some of the other sessions. We've got some trainings we've done for that. There's another question. I often find myself in a certain dilemma where I want to champion for the advancement of helpful technology, but at the same time, I wonder, how do we encourage users to break away from screens and overt digital dependency, especially in landscapes where work, education, entertainment, socializing are all happening virtually? So as educators, how do you balance kind of the more technology or more immersion with these sorts of, I don't know. Have you all thought about that yet? What do you think?
So one of the things that I always try to think about with regard to this is kind of go back to, what are your learning objectives? What are your learning outcomes? What is it that you want to, teach students or facilitate learning about? And then think about the different modalities out there. I had noticed a comment about haptic gloves, and because, haptics, can be important with certain skill-based things we teach in, health profession education. And so I think that's where, you sort of think about your learning theories and your learning goals, and you say, well, if it requires that level of hands-on interaction, then it may not be best for a VR or even a mixed reality environment. It might, just depends on what you're doing, mixed reality with a mannequin and that. So to me, it's really sort of thinking about, well, how do we match the technology with what we're trying to teach people? And then where are the advantages in some of this technology? For instance, with some of the VR programs we were talking earlier, it's a way for people to go in and practice and practice and practice. And sort of that whole concept around mastery learning, even if it's sort of, practicing a similar type of thing, you can get some feedback and things. So I think the bottom line for me is, where does it fit? And where can we leverage it in achieving our learning outcomes? And if we think, and we kind of use that to guide us, much like we've done in some of the early work with simulation, then I think we're going to get there.
Great. Oh, that's good. Let's see. Lots of good questions popping in here. They're coming fast and furious now.
There was one on content creation, and I think it's an important one. You will see throughout various sessions, lots of projects that were created essentially in consultation with faculty and expert developers. So it is still an ongoing research area to really enable maybe non-technical people. So quick shout out to my PhD student, Shweta Rajaram. She's been working on tools to help instructors actually create AR content to enrich paper-based materials. And I think these smaller enhancements to teaching, I think are very, very important and powerful. It doesn't always have to be replaced by this complete virtual classroom. In fact, we may not want that. So I think we should look for the small ways to bring these technologies into the classroom, not the big invasive, we just need $500,000 computer rooms. I don't think it has to be that way. So
great. Well, we have time for one last question. Jonathan, I'll direct it toward you. As a faculty, what was it that sold you on adopting XR when you first tried it?
Oh, that one's easy. Well, I think in architecture it was, again, I'm going to go back to, I was the faculty member that was presenting the cryptic drawings on the screen to a class of 110 students, and they were all looking at me like, I have no idea what you're saying or what you're talking about. And especially in architecture, and I can talk from the architectural perspective, is that during that time, we were building the addition to the Taubman College School of Architecture. And so I was able to walk the students over there and show it to them in real life. Once that was done, though, I couldn't do that anymore. So I had to reinvent a way of how do we kind of show this. And realizing that was kind of the aha moment. It's like, you got to get students on the construction site. And for reliability reasons, that's very difficult. So we said, okay, well, take this. This is a great opportunity to use the knowledge that we have of building things in 3D and in digital space. And how do you begin to present that to students and allow them to kind of go through at their own pace as well. So again, rapid fire lectures are 2 hours or an hour long. And I'm not sure how much actually is embedded after one of those, but now students can take a lot of this information that we're building, the content that we're building for it, and kind of go through it at their own pace. And I think they have just a much more well-developed grasp of it after they've gone through it through something like that. I think so that's what really sold me on it. It just became a tool that seemed obvious in my field of work to adapt it for teaching. And not only teaching the information that they need to go out and practice in the future, but also to design with. So it's both a teaching tool and a design tool that we're teaching. So it goes hand in hand.
Yeah, it's that was that aha moment. Well, we're a little bit over time. I don't want to take away from the next session. So thank you all so much for the talk today. Thank you for being XR Innovators in Residence. So please jump over to the next session, and we'll see you back on the main stage a little after 3.